Joined now in Studio 3 by Dr. Katherine Gergen Barnett, Vice Chair of Primary Care Innovation and Transformation at Boston Medical Center, Associate Professor at BU Medical School, and an Aspen Institute Health Innovators Fellow. Doctor, it's good to see you.
Wonderful to be with you both.
Great.
So we were watching those hearings last week with RFK Jr. When he said that everybody in the United States who wants a vaccine can get a vaccine. Is that true?
Yeah, really complicated and good question. So I think all of your listeners will know well that there's been quite a lot of unrest that's happened in the CDC over this past summer and obviously in August. Usually CDC comes out directly after the FDA saying what people can get or not get for vaccines. So FDA last week announced that for COVID vaccines, it's really just going to be for people 65 and greater, or those people with some sort of medical condition that puts them at higher risk. I've spoken on the show in the past about what that long list is. It's important that listeners look at that. But that is really different than than opening the doors to people to get vaccines. This kind of question has now put each state in a different situation. So currently, if you are in Florida, we know that the attorney, the head of the health,
Surgeon General,
yeah,
whatever
thank
he
you.
is.
I almost said Attorney General, but Surgeon General came out last week and said that actually no children need to be required to get vaccines. So obviously that's different than saying you can't get it. But in a way, if you're thinking about it, it actually closes the door in the other way, because if you're not putting pressure on pharmacies or hospitals or clinics to have more stock of more vaccine, right? If you're creating that sort of confusion, then people who want to get things may not be able to get them. So that inherently is placing barriers between people and getting vaccines. So there is a lot of consternation that came out with the Senate hearings last week. We certainly can get into that. But the fact is it is making it more difficult for people to get vaccines.
You know, it's not only concretely difficult,
Yes.
but when there's confusion, as somebody who used to work in electoral politics,
Yes.
when you're really confused, you know what you do? You don't act.
Right.
You
So
do
true.
nothing because you're
So
not
true.
sure what. So are we getting
exactly
them? Are we
right.
not getting them? So let's forget.
Yes.
You know, we talked earlier. Maura Healey became,
Yeah.
I think, the first governor in the country
Correct.
to say she was going to order insurance companies. They will cover it. But the thing was unclear to me in the reporting, and maybe I just missed it. If you don't have private insurance, will you be covered, or will you have to do an
Yeah.
out-of-pocket thing?
Yeah, so there was the Globe had a front page story, I believe, on Saturday, a sort of FAQ about just that. So people who are self-insured, there's the debate, the jury's still out
Oh, it
on
is?
that. Yeah, so there's some thought that the DPH for Massachusetts will also step in for self-insured because it really, it creates a really important safety net for our entire state to be able to say, to your point, Jim, cut through the confusion, just say everybody 6 months and up in our state can get COVID vaccine. Ages 6 months to 5 years, those children need to get those vaccines in their doctor's offices. But 5 years and up, our pharmacies are now offering COVID vaccines. And just really, really important. So until last week, Massachusetts was not allowed, our pharmacies were not allowed to give vaccines that were not already pushed forward and recommended by the advisory committee that comes through CDC. But what Governor Healey did last week was so monumental because she said for the first time, our Department of Public Health can be the one that dictates what can be given in our pharmacies. So it gives us our power back.
You know, you're not only a good citizen, as we know you to be, but obviously a deeply committed, hardworking doctor. When you see RFK Jr., forget the whole pathetic performance, say he wasn't able to answer the question about how many people died from COVID, the level of disrespect, I mean, not only dishonesty, because you could have said, well, there's
Yeah.
a debate. It could have anywhere from 1 to 1.4 million. If you can't, the level of disrespect to the people who died
And their
to serve
families who
an
survived.
ideology, which is all that was about. I don't
Yeah.
want to say the numbers to it.
Yeah.
Well, what was your reaction to that?
I'm incredibly, to your point, is I see every day, I see the impact on humans and their families and their communities of poor public health decisions. And I think the fact that public health has been so cut at the knees with these kinds of decisions and keeping us off and out of the kind of decision making and the tables, takes the stories of individuals and their communities off the tables too. And so, of course, it's angering and upsetting, but more important, it's immoral.
Talking
So-
to Dr. Katherine Gergen Barnett.
So people may recall that RFK Jr. is going to announce what caused autism in September.
Yes.
Uh,
He has announced it. Yes.
Yes. He now
Yeah.
says that there is a link to Tylenol use in pregnancy and folate deficiencies. So what is this all? By the way, Laura Loomer, that other
Yeah.
very odd person who's in Trump's orbit, she's a big Tylenol believer too. But so what do you make of Tylenol and folate deficiencies? I don't even know what folate deficiencies are.
Okay, so I'm just going back to sort of a very basic public health teaching. So when you talk about an association, that does not mean cause and effect. Okay, so for instance, on a hot day, somebody could eat ice cream, and we also know on a hot day, violent crime goes up, right? And this was the quote. You can't actually say that ice cream is the cause of the violent crime, right? So there is, I think it's this importance of this paradox of ubiquity, right? So we know that Tylenol is one of the medications, very few medications, that is considered to date safe in pregnancy. And so pregnant women are taking Tylenol. We also know that pregnant women may take Tylenol for other reasons. They may be having lots of pain, lots of fevers. They may be sick. So we don't actually know necessarily that it's the Tylenol that's causing the autism. The reason that this is even coming up, and I'm not throwing out these, I think levels of inquiry and following the data and following the science is critical. I think we don't want to close the door on this question. I think it's a really important question. We know that there are now studies that have come out, one that was just recently released looking at 46 well-done studies. And out of those 46, I believe there was 27 that showed some sort of association with Tylenol use in autism. Again, association does not mean cause and effect. So there is something there. We need to look at it. But the question is it the Tylenol or is it other things that were happening? How much Tylenol were these women taking? How often were they taking it? We can't do something called a randomized controlled trial on pregnant people. It's not ethical. We can't do that. So we're not going to have a control group with people taking, tons of Tylenol and some people taking it sparingly. So what I would say at this point, as we continue, ACOG has already come out and said there's, there's not a strong correlation that we're seeing or causation that we're seeing. I would say to pregnant women, just like I would say to my patients, if you're going to take Tylenol, take it like other things, take it sparingly and don't take it often. And, I think meanwhile, this idea that we're going to have an answer for what causes autism that's incredibly multifactorial by today, to me indicates that there's going to be more and more of these things that we're trying to find the answer, which is exactly the right thing to do, but perhaps trying to spearhook things too early.
I don't think he is trying to find an answer with all due respect. I think he knows what he thinks the answer is, and he's trying to figure out a way to get to that answer.
Or
you know what I mean?
Or he was supposed to come up with something by September.
Your mic's not on.
Oh, my mic's not on.
It is on
Or he
now.
was supposed to come up with something by September, so I felt pressure to
Gotta
come up
do
with
something.
something in September.
Probably both.
But one of the things I read, and you're the physician,
Yeah.
but that obviously pregnant women get sick like everybody else gets sick.
course.
So if you have a high fever or you have something else
Yeah.
going on, I mean, you could question, should you sit there with a high fever? And what does that
Which
mean
is
for
also
the
causes much
Exactly.
more concern, right, for the fetus.
Yeah.
And by the way, while we're talking about it, like access to COVID vaccines for pregnant women
Very important.
inherently
Yes.
will be something that is going to be life-saving for pregnant women and their fetuses. So
Right.
when we're looking at the span of concerns for different public health measures, I think we need to be taking all things into, consideration and not close the door on the science and not have Republicans or Democrats say this is a terrible set of studies or this is a good set of studies. Let's talk about science as being nonpartisan and continue to do the research.
The folate deficiency, is that have to do with folic acid?
Correct.
Yeah. Well, as soon as you get pregnant, you're supposed
yeah.
to take folic acid.
Before one of the things that we do is we say, are you considering getting pregnant in the next year? And if
Yes.
so, here's your prenatal vitamin.
right.
So this is not new information. We, across the board, we've always recommended women to take folic acid. You can also find it in dark leafy greens. There's lots of other places. We started putting it in cereals and Cheerios and things like that, but don't eat too many of those because they cause obesity.
Okay, so long piece, I think, in the New York Times. The starting point is the
Yeah.
fact that men have a
yeah.
life expectancy of roughly 5 fewer years on
Yes.
the planet than women. And while they say it's a multi-causal kind of thing,
Yeah.
right at the top of the list is after boys stop seeing pediatricians, assuming they do, and
Yeah.
hopefully they do, they stop seeing doctors. Do you subscribe to the notion that that's a major, you're nodding in agreement? And if you do,
Yeah.
what's the fix?
Yeah, I actually I think there was a great New York Times Magazine piece on this Cutler Men's Health that they're opening up, where it's really sort of a culture that's meant to be specifically geared towards men's health, where you've got all kinds of games on the TV, and you're looking out on a field where other people are practicing. And look, the fact is, and I'm so glad we're talking about this because actually September is Prostate Awareness Month. And I know we talked about prostate cancer a lot when Joe Biden was diagnosed. But again, like you don't see people walking around with light blue ribbons, right? Which is like, right? It's people, I think very few people even know that September is Prostate
Yeah.
Cancer Awareness Month. So 14 out of the 15 leading causes of death, so things like heart attack, stroke, cancers, men lead women.
Is dementia the holdout? Is that what it is?
Dementia is the holdout. Alzheimer's, in part because women live longer and they're more likely to get Alzheimer's as we live longer. It's incredibly multifactorial in terms of why, right? So one of the things, to your point, Jim, was thinking about what are the touch points with the healthcare system that men have versus women. So, once you get through all of your childhood vaccines, all your well child checks, then at that point, you're less likely to come in because men don't necessarily think, oh, there's something specific I need to do, right? Women, you need to go in for your pap smears, you need to go in for mammograms, you probably are thinking about some form of birth control, then you get pregnant, you're going for all those pregnancy, visits, and you have postpartum. Like there's a million reasons why women go in. Men don't necessarily have those kind of touch points that are designated. So that's number one, we need to create more of those touch points and be really clear about how we create those for men. So talking about could you have a cardiovascular men's visit, right? Where you're actually doing the screening for high blood pressure, you're doing the screening for cholesterol, you're talking about smoking cessation. The second piece is stigma. So men have, for what better or worse, there's this masculine culture of I don't need anybody, I'm good. If I'm in pain, I'll just tough it out, right? And so we
I'm the
see
exception
that.
to that rule. I should be
When I
clear.
was reading this article, I was
Big time.
definitely thinking about you.
Jim has found his touch
I
points.
know.
There's
I
no
know.
stigma. He's there.
You should start these clinics, Jim. You should be
Yeah.
I'm
I
sorry,
get,
go ahead.
collaborate with you. And then the
Get
third
more
thing is
doctor's appointments.
I'm
how
proud
do
of it, by the way.
and also be more creative about where we do men's health. Go out into the community. all the barbershop initiatives. That's amazing. Go out to sports bars. Go
What's
out
the
to other
barbershop
places
initiative?
where you're actually going out and you're doing public health education in a barbershop.
Oh,
Where
okay.
men hang out. They don't just go to get a haircut. They go to connect to people. So I think we're not being creative enough. And then, and then also being really clear about things like, for instance, prostate cancer screening. We know that is, again, it is a shared decision-making process. In other words, you men from 55 years of age to 69 who are average risk need to have a conversation with their healthcare provider of what are the risks of getting cancer screening? What are the benefits of getting cancer screening? What are your goals? That doesn't easily happen in a 15-minute visit.
How's your
For
prostate, Jim?
providers.
Well, that's not your business,
that is,
actually,
you guys
but
can
thank
talk about
you.
that after too. Yeah.
I
So,
have a couple aches and pains I'm attending to. Thank you for asking.
but that's really different than a woman at age 40 be like, you're due for your mammogram.
mammogram.
So
Yeah.
I think that we need to be a lot better about creating spaces for men and also start to set up things where like, this is your man physical, right? And actually creating different language. And I really appreciated that these points were raised.
So we've heard all about these weight loss drugs, GLP-1, I guess they call them. But I read a
Heard all about. You're acting like heard all about. It's like
probably-
everybody
yeah,
is taking
I
them.
think you guys have
Restaurants have
talked about
changed
it.
their menus.
Yeah.
It's like the biggest
They're
thing in America.
microdosing it with GLP-1s.
Well, yeah, they're microdosing.
Yeah.
And because they think it's going to keep them living longer, but then some people think they shouldn't be taking them at all because of side effects. Wait, what's the latest anyway on these microdoses?
Oh, the latest is
GLP-1s,
impossible. It's
Marty.
impossible to keep up. And I will say that even as a physician who's on the front line, I know very well how it works. I can remind your listeners quickly. But in terms of being a provider, understanding which insurance companies are covering what for what, right? So we know there was everybody wanted a GLP-1 agonist, right? Everybody was going to the doctor. I have people just last week clamoring to me saying, I really want to lose some weight. I can't lose weight, but I don't have diabetes and I don't have all these other things. So starting to have those conversations of like, guess what? We're actually going to stop covering those things. Not we. Insurance companies are going to stop covering GLP-1s for people unless they have diabetes. So that's starting to happen. On top of that, we're starting to have people be called by physician, like PBM. So basically it's people who are calling patients and saying, I'm sorry, I know you have been on a medication called Zepbound forever. I'm now going to put you on Wegovy. Zepbound and Wegovy are both GLP-1 agonists, but they don't work the same way, right? And so patients are actually now getting together a lawsuit to sue the PBMs to say, you're telling me I can't have access to this medication, and yet you don't actually know the clinical impact on my life that has. So as a physician, I can write a letter of medical necessity and it won't do anything necessarily. So it is a very challenging landscape for patients right now and for, I will say, providers to navigate, because we're also stuck in the middle of high costs for our state, our health insurance, pharmacy managers who are the in-between, and patients who are saying, look, I just got access to this. My life is turned around. I've gotten so much better. And now you're telling me I can't have access.
Yeah.
Okay, we only have 3 minutes left. We're going to have fun for 3 minutes
Okay,
rather than beat each
perfect.
other over the head.
No, that was
last
so
week,
fun.
Well, yeah, it was a lot of fun. Last week, we were talking about revenge, essentially.
Oh, yeah.
Getting back at
so
people
good.
for doing you wrong.
Yep.
And we played the most famous line of revenge ever from Princess Bride, and here it is.
Hello. My name is Inigo Montoya. You killed my father. Prepare to die.
It's obviously the legendary Mandy Patinkin. You apparently were listening, and more importantly, you have a connection to Patinkin?
Yeah. So I was literally just finished with patients. I was walking over to the hospital for meetings. I was listening on my AirPods, and I was like, oh my gosh, they're playing Mandy Patinkin. So Mandy Patinkin is my husband's cousin and a dear friend.
He is?
Yeah,
wow.
and an incredible, human being, and spent a lot of time with him. And his kids are some of our closest friends as well.
Have you ever seen I don't know if it was on Twitter or on Instagram. There are fabulous videos of him and his wife.
Of course.
Dancing at home. Oh my God,
so
they're
Gideon,
so great.
Gideon Patinkin is their son, who we're also very close to, and he's the one that makes all those
Oh,
videos.
that's great. They're
and
terrific.
they're all in upstate New York, where we've spent a lot of time, my husband and I, and our kids. And so it's so funny to
Wait a minute,
watch them do their shtick.
They dance around the kitchen?
No, they
What
have such a shtick. And
They have a shtick is what they-
It's an
Dancing shtick?
amazing, just everything. The way they connect, the way they dance, the way they talk about
Oh.
politics. They do great work in the world.
Well, speaking of work in the world,
yeah.
beyond him being a brilliant performer, I never even knew when I'm watching Homeland
Yeah.
that he had been a Broadway star, and he's an incredible
Yeah.
singer.
Yeah.
One time we interviewed him, other than when Catherine's going to get him for us next week, the one time we interviewed him, he had just come back from Greece where he was
That's
helping
right.
Yes.
refugees.
That's right.
I
Yeah.
mean, the guy is just
Yeah,
incredible.
he's a beautiful person.
He really is.
Yeah.
Wow.
So I had
great.
to tell you the connection.
How great is the film, too? One of the greatest
Oh,
films
the
ever.
best.
It is. Doctor, it's great to see you as always.
As
Thanks so much
always.
for
No,
your
she
time. We
romps
appreciate
with
it.
the stars over
She
here. We
does.
didn't know that.
Unlike
Yes.
some of us.
Okay.
That's correct.
We've been
Take
speaking
care.
with Dr. Katherine Gergen Barnett, Vice Chair of Primary Care Innovation and Transformation at Boston Medical Center, Associate Professor at Boston University Medical School, and Aspen Institute Health Innovator Fellow as well. Thank you very much for coming in, Dr.